Saturday, I gave a presentation to research leadership at UT Southwestern. The topic was AI, but not in the way you might expect. Over the last year, we've seen an explosion of AI activity across healthcare. AI is being used for documentation, patient messaging, clinical decision support, prior authorization, and many other tasks. And like other academic health systems, UT Southwestern is investing heavily in these capabilities. But sometimes we're asking the wrong question. The question that most people ask is, how can AI improve this task? How can AI write notes? How can AI summarize charts? How can AI answer patient questions? These are important questions, but they focus on individual tasks. And I think an important question that isn't being addressed as often is, how should healthcare be redesigned now that intelligence is abundant? In the past, intelligence has been one of the scarcest resources in healthcare. Clinicians spend years training to acquire it, patients travel to access it, and health systems organize themselves around it. But now, we suddenly have systems that can summarize, classify, explain, draft, monitor, and predict. The question is no longer whether AI can perform certain tasks. There's mounting evidence that it can. The question is how care should be delivered when these new capabilities exist. This requires a shift from problem solving to what Ron Lee at Stanford calls care model engineering. Problem solving focuses on individual issues. A workflow is inefficient, a process is delayed, a task is burdensome. We fix the problem and we move on to the next problem. We still need to be doing that. But at the same time, care model engineering starts at a different level, and it asks, how does this entire care model work? What does the patient journey look like? Where are the delays? Where is value created? Where is friction introduced? How should patients, clinicians, technology, and AI interact? Only then do we ask what role AI should play. For example, consider chronic disease management. Traditionally, patients come to clinic every few months. The physicians review data, discuss treatment options, and adjust medications. But now imagine a different model. Patients prepare for the visits with AI, which they're already doing on their own. Questions are collected before the appointment. Educational materials are personalized for them. Care gaps are identified automatically. The physician receives a concise summary of what matters most to the patient and what the guidelines suggest. Follow-up occurs asynchronously when appropriate. This isn't just a better tool, it's a different care model. It may sound completely operational, but these questions create a lot of opportunities for research as well, because we don't know how to do this yet. How should patients interact with AI? How do we preserve trust? What information should clinicians see, and when and how? How do we redesign workflows? What outcomes matter most? What should happen at home versus in the clinic? That's a really important question to be asking right now. These aren't just technology questions. AI has great possibility, but it hasn't transformed healthcare yet. So to me, these are the questions that will create the healthcare of the future. At UT Southwestern, we're beginning to think about how we can create environments where patients, clinicians, researchers, and students can work together to answer these questions. Because ultimately, the goal isn't to deploy more AI or more technology. The goal is to create better ways of delivering care. Devin Mann from NYU Langone spoke in our grand rounds last week, and he's been addressing these questions for several years. Through his leadership, problems in the healthcare system drive research, and research is applied to solve those problems. He leads a health system team called Future Practice that's exploring desirable futures for healthcare to make it work better for more people. They solve problems and they're re-engineering care. Watch his presentation on our YouTube channel if you weren't able to attend. I think you'll be really inspired. I discovered Andy's frozen custard recently, and so did Gorm. He enjoyed finishing off my vanilla cup Saturday night.